Hi, I'm Dr. Anndrea Hatcher from Olive Branch Parke Veterinary Clinic, and today I'm going to talk about gerbils. At their adult size, they are 4 to 5 inches long, and their lifespan is 2 to 4 years. They are diurnal, which means they are active during the day. They should be kept at a household temperature, not above 80 degrees Fahrenheit, and the humidity should be less than 50%. Their enclosure should be metal. Gerbils are notorious chewers and can chew out of plastic cages. Choose an escape-proof metal cage that is easily taken apart for frequent cleanings. The cage should be cleaned as soon as you notice an odor to the bedding. Aquariums do not provide enough ventilation. Provide them with 1 to 2 inches of paper bedding, such as Carefresh. Do not use cedar shavings. Gerbils love to burrow. You also want to provide them with a wooden hide. Nothing in the cage should be plastic because they will chew it. Gerbils appreciate a safe, adequately sized, solid wheel to run in. Avoid wheels with spokes or that are not solid because they can get their tails caught and injured. Their teeth are constantly growing, so they should have plenty of wooden toys and chews to keep their teeth a healthy length. Gerbils can be kept in same-sex pairs if they are raised together. Otherwise, they should be housed alone. So the equipment that you'll need if you're going to keep a gerbil would be a safe and appropriately sized habitat, food, bedding, nesting material, a food bowl and water bottle, exercise wheel, wooden shoes and toys, a dust house and dust, and a wooden hide. For food, feed high-quality gerbil food and offer that free feed. If you feed rat or mouse diets to gerbils, you can get dental disease and diabetes. A small, limited amount of vegetables such as kale, dandelion greens, escarole, and other leafy greens, although not iceberg lettuce, can be given a few times a week. Avoid anything with sugar or high fat. Change the water in the water bottle daily. As of 2013, owning gerbils was illegal in California. Gerbils can live in family groups, but they don't often accept new gerbils into their cage, and this can result in fights and cannibalism. Rodent tears contain lipid and porphyrin-containing secretions that can make the tears look red and are sometimes mistaken for blood. Most rodents can't vomit. Most rodents also normally eat some of their own feces. This helps them to digest certain nutrients. Gerbils are spontaneous ovulators and are polyestrous, which means basically they breed a lot and they breed often. Only female gerbils have nipples. They also have separate external openings for urethra, which is urinary, vagina, and anus. To confirm gender in young male gerbils, it may help to hold them vertically and apply gentle caudal abdominal pressure to allow intra-abdominal testes to pass into the scrotum. Pregnancy is 23 to 26 days. Normal litter size is 3 to 8 gerbils. Their ears open at 5 days old, and their eyes open at 16 to 21 days old. They are weaned at 21 to 28 days. The females may start breeding as early as 9 to 12 weeks old, and the males at 9 to 18 weeks old. This information is important so that you will know when to separate parents and children and littermates from each other to prevent inbreeding, which could result in genetic abnormalities. Both male and female gerbils have a small tan bare spot on their tummies, which is a scent gland. Gerbils are susceptible to diarrhea, tail slip, nasal dermatitis, seizures, cystic ovaries, kidney disease in older gerbils, malocclusion, which is overgrown teeth, mites, and tumors. The most common tumors in gerbils are ovarian cell carcinoma of the sebaceous ventral marking gland of male gerbils, melanoma, and oral cholestoma. They can also get respiratory diseases and eye infections. Gerbils can transmit lymphocytic choriomeningitic virus, hantavirus, Corynebacterium cusheri, Leptospira interrogans, Pasteurella toxida, Pseudomonas aeruginosa, Salmonella, Yersinia pestis, rabies, monkeypox virus, cowpox virus, Giardia, sarcoptic mange, and ringworm to humans. If gerbils are grabbed too tightly by the tail, the skin may come off. The treatment for this is surgical amputation of the tail. If you notice your gerbil experiencing weight loss, hair loss, diarrhea, labored breathing, eye or nasal discharge, skin lesions, or lethargy, you should contact your veterinarian. Do not give gerbils dihydrostreptomycin or streptomycin. New gerbils should have a physical exam and an intestinal parasite exam by a veterinarian and yearly exams after that.